So welcome everybody for this mental health rights forum. This is going to be a presentation that's done in order to interact with all of you guys that are connected, whether it is on Zoom or in person here. The purpose of this presentation, I'm going to show it to you so that you have an idea on what we're going to be doing today. I want to keep it very informal so that everybody can participate, exchange information, and see what you guys are doing out there. And we can exchange resources and we can exchange different tips and things that you guys do. The points of discussion of today and the purpose of why we're doing this. We're going to talk about the Florida-Baker Act, its history, and its impact, specifically on human rights of individuals, kids, adults. The informed consent right is another thing we're going to take up. And we're going to see and go over certain action steps to help mental health patients. And at the end, we're going to go over some of the available community resources to help people that are having trouble with mental health rights out there. I specifically and on purpose did not put almost anything in that last slide because I want everyone to interact and see what do you have to bring to the table today. So before we go on, now that you have an orientation on what we're going to go over, I would like for everyone to introduce themselves with your name, the profession or the activity that you're doing out there, and what is your interest in mental health rights, okay? So I'm going to start with, I'm just going to point at people as we go. I'm going to start with the first person that comes on the screen here on Zoom, Miss Anita Barnes. Are you able to please introduce yourself to the group?
Everybody, my name is Anita Barnes. I'm a grandparent. I'm a concerned citizen and an activist, and I'm very concerned with the abuse in the schools, the frequent Baker acting, the abuse of the high population of foster children. And
good.
there you have it. Thank you.
Fair enough. Thank you, Anita, for doing that. I would like now for a person in the audience here to introduce him or herself. I'm going to start with the only man that is in the room here apart from me, Mr. Frank. Could you please explain who you are and what is your interest?
Okay, Frank Sardella. I'm a performing artist. I'm also a public relations specialist for wellness, like natural wellness type practices. I'm very aware of a lot of these types of things that are going on and a lot of injustices that there are in healthcare alone. But the Baker Act, having come to my attention, has become front and center in my interest. So I'm here in the interest of helping get the unjust use of the Baker Act under control and obliterated.
Fair enough. Thank you. Next, I would like for Miss Frances on Zoom, if you don't mind, to please introduce yourself as well.
My name is Fran Hess. I'm a professional educator. I am the wife and former caregiver to my husband who had Alzheimer's disease and passed last March. My mission is to improve the care and understanding of those suffering from Alzheimer's, including any ramifications that may be associated with the Baker Act. I would appreciate it very much if anyone who has any resources and information that can help me become involved in fulfilling my mission.
Fair enough. Thank you, Francis. Next, I would like for Mrs. Monica, if you don't mind, to please introduce yourself.
Sure. My name is Monica Sardella. I work for a consulting company called Advanced Medical Integration. So I'm in a consulting business. I'm also a mom. So my interest in this is for being a mom, first of all. So, to protect the young and the elderly, because I feel like they are the biggest targets. And with the just last thing that I was here for and the information I got on the Baker Act has sort of opened up my eyes a little more into how we are also targets of it in some way.
Fair enough. Thank you for that. And next, I would like for Miss Asia Clermont, if you would like to please introduce yourself.
Yes, good evening. My name is Aisha Clement, and I am the owner of Agape Gym Care, which is a holistic care at home, and we deal with patients that have in any of the spectrum. I'm also the chair for the mental health and wellness and safety committee for the Florida PTA, and I do advocate for the children, and there's so many issues with, especially in the school system, in regards to the Baker Act and in regards to, is everything is subjective to how the person perceive and act upon that, the abuse of it. So I think I'm here today just to get more resources to educate the parents that I come across with as a PTA committee chair.
Fair enough. Thank you very much for that. And next, I would like for Ms. Tammy, if you don't mind, to please introduce yourself.
Hi, my name is Tammy Martin. I work with Wounded Veterans Relief Fund, helping disabled veterans get their dental care. And I also do respite care with Children's Home Network, providing caregivers time away for children, usually from newborn up to the age of 12, that have medical disabilities or ADHD. I also have my own nonprofit for children in foster care. So I'm a big advocate for children in foster care and youth. And my main focus is the Baker Act, like what are we going to do with it? You know, it needs to go away. I agree. And also mental health issues we need to be out there, I think, advocating more to de-escalate a situation so that it doesn't get them Baker Acted.
Fantastic. Thank you for that.
Thank you.
And next, I see a Mr. Dan Kane. Would you mind introducing yourself to the group?
Yeah, I'm Dan Kane. I've been a licensed mental health counselor for coming up on 29 years. At the time, I've never Baker acted anybody, so I'm pleased with that. So, but I'm sort of on the other side of the system, providing care for individuals that get caught up in the system.
Fair enough. Thank you, Dan. Thank you for being here. And I would like as well for Miss Claudia, if you don't mind, please introduce yourself.
Yes, my name is Claudia Tellados, and I write books for language learners, for people who want to learn the Romance languages. I'm also 26 years in the dental field, but I'm here because my husband was in the Air Force. So in seeing how the VA treats their patients and how the first decision is to always put them on some kind of medication. And I'm here to learn about this Baker Act and see how I can contribute with what I know.
Fair enough. Thank you. And I believe I covered everyone. Thank you all for being here for this get together on this. This is a forum. So if you don't know the definition of a forum is a place, an event, or even a location where you talk about a specific subject matter, an issue, and you discuss about this. In ancient Rome, a forum used to be a huge location that was gathering individuals, and they would have talks, theater, different types of things. I'm not saying that we're going to start acting out here, but I'm saying that this is a spot where we are able to discuss the subject of mental health rights. It covers a lot of things. I know today we're not going to be able to cover everything, but maybe on the next one, we can cover some subject you might have more interest to. Good. So now that we are introduced, I'm going to start moving along on the little presentation here. We're going to start with what is the Baker Act? Some of you might be familiar with this. Some of you might not. I'm just going to go through this, okay? And we're going to be able to discuss on that. It says here, in Florida, the law which covers all parts of mental health treatment is called the Baker Act. The Baker Act has become the slang term for one part of this law, involuntary psychiatric examination and commitment. If you meet the criteria for a Baker Act, you can be taken away in handcuffs by law enforcement without your consent and held for 72 hours or more in a psychiatric institution. A minor must receive the mandatory involuntary examination within 12 hours of arrival at the facility to determine if they, in fact, meet the criteria for the Baker Act. This presentation covers what this is and how it affects Florida residents. Again, we're not going to go through every single detail of the Baker Act, but we're going to cover a deep enough introduction to it so that we can all have a better understanding overall on it. The history of the Baker Act. So in 1971, the Florida Mental Health Act passed, which brought a revision to Florida's 97-year-old mental health laws. So Mrs. Baker, and that's why the Baker Act, was the lady. She was a House of Representative at the time, and she's the one that introduced that law. In the name of mental health, we deprive them of their most precious possession, liberty. That's what she said. Believe it or not, before that law, mental health laws were even, it was worse, basically. People could be held in a psychiatric institution for an undetermined amount of time. Okay. Some statistics of the Baker Act. You should know that 202,595 total involuntary examination were initiated in between the year 2019 and 2020. This includes 35,360 minors. So this is from the Baker Act report that's put together by the Florida Department of Health and the University of South Florida. The law states, I'm just going to cover a couple points so that we have an introduction on the subject here. A person may be ordered for involuntary inpatient placement for treatment upon a finding of the court by clear and convincing evidence that he or she has a mental illness, and because of his or her mental illness, and then just on that point, that's the last piece of information on the Baker I want to talk to you today is, what does that mean legally, mental illness? I just got off the phone with somebody that was telling me that they had an elder parent, Baker acted. Would it be possible that that parent had dementia? Does that fit the criteria? Etc. Those are questions that we're asking whenever we encounter this in life. So legally, mental illness means an impairment of the mental or emotional process that exercise conscious control of one's actions or of the ability to perceive or understand reality, which impairment substantially interferes with the person's ability to meet the ordinary demands of living. The term does not include a developmental disability, intoxication, substance abuse, or conditions manifested only by dementia, traumatic brain injury, or antisocial behavior. So that's quite enlightening just on that topic, because I probably get about 5 calls a week of individuals that are being Baker acted because they are being drunk or they are under the substance, under the influence of a specific drug. And it should be. They shouldn't be affected by it per the law. Good. So the next step is, and that's the second discussion point, informed consent. Tell you what, before we go into informed consent here, we're going to stop on the Baker Act. First of all, I'd like to see if there's anything that you guys would like to bring up on the subject of the Baker Act from your own standpoint, from your own observation, etc. If anybody would like to share anything, and now is the time.
For me, I guess, because I'm just learning about this. So basically, like there's a event here, what is it called, where everybody dresses up like pirates and then wear
the Gasparilla Parade.
Yes,
in
that.
Tampa. Is that what it is, Dan? That's the Gasparilla Parade?
Gasparilla, yes.
Okay, good.
Yep.
So basically, if somebody sees a drunk and somebody has the ability to Baker act that drunk, they could actually Baker act a drunk person?
It is being done.
Supposed to, but they do.
Oh, wow, that's gonna be abuse of.
There's a separate law, though, the Myers Act, which covers alcohol and substance use. Same basic thing, only the criteria instead of mental illness is impairment due to substance use.
It is called the Merchman Act. Is that correct, Mr. Dan?
Yeah, the Myers, no. Yeah, the Marchman Act. Yes, Stuart Marchman. Yes, the Marchman Act.
Fair enough.
Yeah.
So that would be the appropriate law for somebody that is under the influence, if need be, if you need to actually get that person out of the environment.
Sure, I mean, I was just wondering, like, so someone could like just for a feel of superiority say, I'm gonna Baker Act this person.
That
And
is
if he
correct.
doesn't know, then he could be Baker Act and held for 72 hours or something.
That's right. Yeah, obviously this law has a very specific intent and it's being weaponized. It's a law that can, I do know that I can call the police 911 and explain how you have been having trouble and you are probably about to do something wrong to yourself. And they're most likely going to come by and check it out. And if you say the wrong things, off you go. You might be Baker Acted. That is possible. Anything else that anybody would like to bring up on this topic? Fair enough. Good. So we're going to move on. The next subject is going to be the informed consent right. It says here, informed consent is a legal document in all 50 states prepared as an agreement for treatment, non-treatment, or for an invasive procedure that requires physicians to disclose the benefits, risks, and alternatives to the treatment, non-treatment, or procedure. Does that make sense? Mm-hmm. So, and it explained further here, it is the method by which a fully informed, rational patient may be involved in the choices about his or her health. Informed consent applies to mental health practitioners, psychiatrists, psychologists, etc., in their treatment with their clients in generally the same way as physicians with their patients. So I see a question here in the chat in regards to what's the CCHR role that we have, what's Citizens Commission on Human Rights. I'm just going to say something here openly to everybody. What we do is we try to make sure that informed consent is actually respected. That's one of the very big goals that we have. We act as a watchdog organization, over the field of mental health, and we make sure that rights of patients are protected. Mrs. Francis, does that answer your question?
Yes, I just don't really know. I don't know the structure of the organizations that deal with mental health in Florida and what their role is. And see, I'm really looking to find out how I can be involved in possibly making improvements to the treatment of people, especially those with Alzheimer's. So I just didn't understand. I was just hoping that I could get a better understanding of the different organizations that might apply to the things that we're talking about. And then what is your role and what does CCHR do? Is that something that was set up by the state, or is this just set up by citizens on their own? I just don't understand the setup.
Not a problem. Let me answer that question. The Citizens Commission on Human Rights was co-founded 53 years ago by Dr. Thomas Zaz. He used to be a psychiatrist at the time, and the Church of Scientology. And that was put together as a nonprofit organization to help mental health patients to make sure that their rights are protected. We do have a hotline, and we receive about 5 calls a day on the hotline of incorrect use of the Baker Act. And we work with the Department of Children and Family in Florida. We work with legislators, with attorneys to protect the rights of those patients through public awareness. We try to pass laws, and we consult other groups on what their goals are. And we see how we can work with other community groups on the same objectives, basically.
When you say you try to pass laws, so you put together things working with the legislators and support them, or you follow certain legislators that do have an interest in it, or you support motions and laws that are being proposed by them?
All of what you just said. We have about 4,000 members for our nonprofit organization, supporters, and we consult legislators on what their intent is in regards to mental health and treatment of mental patients. And we're going to communicate what we think would be correct to our members. We see what they think about it. And if they are interested in assisting or helping in that goal, they're going to contact their own representatives, share their concerns. We visit them in Tallahassee. We sometime are going to write and propose laws to specific senators or House reps. Last week, I met 2 House of Representatives in Clearwater here, and they both agreed that the Baker Act shouldn't be done that easily on minors. And those are people that I'm going to hopefully be able to meet at some point if they're available, you know. But we have a lot of individual cases. So people calling us on the hotline, sharing what occurred to them, and we are able to file a complaint to agencies like the Department of Health, and others. And we try to make sure that they know what's going on in their area.
Mhm. Well, I'm sure that some of the people that are involved in it are writing their own letters is some departments if they know where to write the letters to. So anything that your group does would be an advantage as well, because the more that are on board, the more it's heard. You know, they're squeaky the wheel, the more it's heard. But are there any other organizations in the state that are similar to what you do? And are there any particular legislators that are very much on the side of what you're trying to do that we should be alert to, so we could be in their corner or trying to get on certain maybe legislative committees to help make a difference?
That's a very good point. I love that that thing actually. Yes, there are other groups. I mean, there are different nonprofits that exist in the state. A couple of them that I can tell you on top of my head are, I mean, I know that there's a group called Parental Rights Florida that really appreciates parental rights specifically. I know of the Southern Poverty Law Center. They really appreciate the attention that we have on making sure that minors are not Baker Acted just like this. I mean, even Mrs. Asia Clermont, I'm assuming the Florida PTA also have a legislative committee, and you guys have been also involved, you know, on assisting on specific legislation that at least we agreed on as well. If Asia, you would like to share anything from your own organization, that is totally fine.
We are not, I'm not able to share anything because for that I have to seek approval.
Okay.
To be able to speak on behalf of the PTA. So that's the only thing.
Totally fine. No worries at all.
Thank you.
So Francis, those are some of the organizations that I can think of that we've been at least in touch with to some degree or another. Some of them agrees on certain things, and some of them agrees on other things, and we try to see what is the agreement point that we can have with them. If that makes sense.
Do you know of any particular legislators that are really in the corner of those that seem to have similar interests as we are in this group?
In regards to the Baker Act, I can tell you what I could do is I could put together somehow a resource like a PDF with the names of those that are in the interest to make sure that
Very good.
the Baker Act shouldn't be done on minors in a very loose manner. I can provide that. That's why I want to do this kind of meeting, so that there's questions like this. So we're going to take notes here. Who's going to take notes?
Can I offer something?
So just Francis, on this, I can provide you and the rest of the people the names of the senators and House reps that we know are in agreement with that issue. Absolutely.
Thank you.
Good. Mrs. Anita?
There, I came across a psychiatrist, maybe not a psychiatrist, he might be a psychologist, attorney. He is currently with the Florida Disability Rights Advocacy Center in downtown Tampa. He has a whole article I found online about why children should not be on psych drugs.
Okay.
So he would be an excellent contact possibly joining, he might be interested in working together with CCHR or aligning with you. I know I printed it out. It just hadn't occurred to me to try to connect those dots.
Okay.
But
That's
yes, I found his report very, very informative, and also with his expertise. He's the type of person that would be a great resource and an advocate.
okay. That's a great idea.
I'll have to get with you. I have to find that report and get the name to you.
Please, absolutely. We can meet with him. We can meet with him. We can see what his views are and see if we can agree on that and work together. Totally fine.
Could I just say something more?
Absolutely. Go ahead.
So yeah, I am an educator basically, and so I really was not aware of that the Baker Act would be an issue with kids in school, and so that is a concern to me and in highlighting and something I'd definitely be interested in. But I have to just share that because of what my husband went through with being Baker Act as being in Alzheimer's and also being not allowed back into a memory care facility after they did that to him. That is my main focus. And so that's where I'm going to put my energy. And that's where I'm trying to look for people who are specifically have to do with the Alzheimer's and the Baker's Act. Although the other is interested, I would support them as well.
Gotcha. I understand. I understand where you're saying. I think I did provide you with a couple pieces of information. I have more information on the Baker Acting of elderly, not saying that every elderly has Alzheimer's, but I do know some people like that. I can turn you over a couple people contacts that I know that are very interested in protecting elderly specifically. But I believe there is a link here with I would say a lot of people that have Alzheimer will be in an advanced age most of the time. I don't know if we can agree on that, but I can share with you contact as well and more resources on that. But
I just ask one, I was just wondering how my name got on this invite list. And not that I'm very happy that whoever put my name in here did it, but I was just wondering how I got on this list.
That was probably me. I'm probably the culprit. Let me find out right after this how I found your name. And then I
have written a number of letters to legislators and to DeSantis, et cetera. So I'm just not sure, but I was very happy to see that there's a group, somebody or something that I can get involved with perhaps and help to make a difference.
Awesome. It's great to have you here, Francis. Thank you for being part of this. Mrs. Claudia, you had a question.
Yes, I have a comment and a question. The comment is I follow you on our CCHR on the Facebook.
Yep.
But I don't see it coming up as regularly as it probably should be.
Okay.
But that's my observation. The other thing is like this Baker Act thing is not targeted just for a certain age group. It seems like it's for like anyone can be Baker.
That is correct. That is a question?
Yeah.
Yes. In 1 year, there was 36,000 kids that were Baker Acted. The rest of them were adults. It was 180,000, something like that. From what I remember from the report, there's a report that's available, and I can share that as well in an email with all the people that are here. From what I remember, most of the people are in between the age of 18 and 50, like the adults part.
Oh.
Does that mean anything? That report contains information on the percentage of Baker Act in each county, under each police district. So it's a very comprehensive report. It shows a lot of transparency on, what's going on with those numbers. So I will share that as well.
Okay. Yeah.
Okay, good. So I'm going to just move on to the next subject. I'm going to try to be on schedule here. Thank you for those that participated. Absolutely. Yes, ma'am. We're on schedule here. Okay, so the next step is going to be action steps to help mental health patients. Again, I'm sharing this here from CCHR, an Advanced Protective Directive or Psychiatric Living Will. This is not the only step to help mental health patients at all. There's way more things here. And I want to at least make you aware of this. It's a form that somebody can fill out and explain that they are not interested in receiving specific psychiatric treatments involving electroconvulsive therapy or brain operation or anything that, it lists it out on the form itself. And they designate a medical proxy, somebody that's going to be in charge of the medical decision in case the person is, deemed to be incompetent or unable to think for themselves. So if you guys have any additional steps or, resources in order to help mental health patients, you're welcome to share them now or put them in the chat, or, if you have ideas and stuff like that. Well, if you think of something, let me know. We can talk about it. Next thing is, on that topic, alternative solutions. What we did as CCHR is we put together a document that has about 65 healthcare professionals, whether doctors, nutritionists, chiropractors, mental health counselors, that are interested in helping their patients, but they're not particularly interested in jumping on the prescription pad or providing a medication. This is something we put together, and if you guys are interested, I can share that as a resource if that's of interest to you. Fair enough. Is there anybody on Zoom that have any additional alternative solution ideas or resources that you can think of?
Hi, I just want to say hello. This is Sheila Matthews, actually from ablechild.org, and I love CCHR. On our organization, we have lists of books for parents that they can read about alternatives and diets. So we have a whole library that people can visit. And then also AbleChild would be very interested in your resources for the doctors who don't want to jump on the RX pads. So I would love to get any information that CCHR has that we can provide our parents that are coming to our website.
That's awesome.
What's the name of the organization and website?
Sheila, what do you mean? Go ahead.
Yeah, it's AbleChild, AbleChild.org.
Oh, yes. That's awesome.
Yeah.
I remember you.
Yeah. And I remember you guys, and I know I haven't been in touch in a while, but I'm also very interested in any of the Florida legislators that are very friendly to CCHR, or the idea of informed consent, because this is a new legislative session.
Okay.
And one other item I really would love to work with CCHR on is, the school shootings. The Henderson Behavioral Health treated the Parkland shooter, and they still have a contract. It's a huge contract with the state of Florida. I would love to do a petition of some sort to get them to lose that. I'm sorry to say, they really should be held accountable, because they were very involved in drugging Nicholas Cruz. So I would love to get some sort of petition where that we get a review of their behavioral health contract for the state of Florida.
Wow. Okay. I think that's a legitimate goal, and I think that's something we can probably help you with, specifically if it's in Florida like this. You're talking about the link in between mass shootings and the side effect of psychotropic medication. Is that what you're referring to?
Yes, that's exactly what I'm referring to. As you know, CCHR has been on the cutting edge of this and has put out a list of all the mass shootings and the fact that they were treated with these psychiatric drugs. And some of them are not approved for use in children. So, it is something, an ongoing thing I'd love to get on the federal level of hearings, but I think maybe Florida might be more of a friendly state to kind of, especially with Parkland, if we could focus on Henderson Behavioral Health and illustrate, that they participated in heavily drugging him since he was, in the adoption agency in the state of Florida.
It's a very good point. Good.
Oh my gosh, I would love, first of all, I need to request that report from CCHR, and I would love to work on with you collaboratively on a petition and making these issues known, because in fact, our Department of Education paints a very different picture to justify doling out millions to schools with the intent to beef up Baker acting children.
Fair enough. I mean, this is something that we can collaborate together on this. Sheila, I can share with you as well this list of legislators, and then Anita, I can provide you with that report. And Dan, Asia, Francis, if that's something as well you guys are interested in, or if you have more resource from even from your side, you are more than welcome to share them. Great. Well, thank you for this participation here. We're now going to touch upon one of the last point, and it is called available community resources. So I literally left it blank to see what you guys have in terms of community resource. What does that mean? Well, do you know of any resource out there? Let's say, Francis, if you know any resources for educators, or Tammy, you mentioned the de-escalation techniques that could be reviewed. Is there any particular ways that we should go about this? Or Sheila, you mentioned, like any resources like this, whether from the state or from other nonprofit or organization, anything comes to mind?
Tutoring. So children that are struggling behavioral wise, we need to start gearing them towards more of a reading, like the fundamentals, like phonics, all this stuff they pulled out of the schools. If we could find some list of tutor centers that do prep work with children of all ages, I think it's a really good idea to support tutoring.
Wow. Is that Francis? Is that that's you? You said that, Francis. Is that correct? Was that you?
No, that wasn't me that was talking.
I'm so sorry. I just want to identify. It was Sheila.
Sorry.
Okay. Thank you, Sheila. Sorry about that. Fair enough. Thank you for that. What do you guys think? Francis, what do you think about that? If you
no, it kind of goes along with what I was saying on the chat. I put that maybe, there was a way that you guys, the CCHR could put some type of electronic folder someplace that we can access resources as people find stuff, or you have stuff, and put them in there. At least we'll all have access to them in one place and can access them at any time. But I think all the things you're saying, everybody is saying, is right on. But I just never gave that much thought, because I didn't know that I didn't teach in Florida, so I didn't know about that issue. I just know what my limited experience is with the Baker Act. But I do understand how students, what they're doing in the schools, changing the emphasis on things and getting away from the important things that help the kids feel better, rather than just be aware of all these oddball things that they're talking about now. I don't know. It's like way off the wall. I think they're adding so much fuel to the fire, confusion for the kids. But I can't even imagine the Baker Act being on kids.
Yep, that is pretty rough. Mr. Dan, is there anything you want to add to that?
It really is a human rights issue. It's one of the few areas where, well, less so than used to be, but in our country where we give away human rights. As soon as you're identified as somebody that, and with no science, no real basis, as somebody that's struggling with your mental health in some way, they can real quickly swoop in and take away your rights as a parent if it's your child. And all of a sudden you find out your child started on some medication or something that, again, there's no science that supports any of those things, those interventions. So it really is it's a major human rights issue. We deprive people of their rights in either the Marchman Act or the Baker Act, that you can have a deputy or somebody show up at your workplace and take you away in custody to be evaluated for 72 hours. Some of these facilities make an awful lot of money because they keep renewing the Baker Act for a certain period of time and over the weekends and things. So you end up all of a sudden you're away more than 72 hours. You're away maybe 144 hours or something before you finally get back to your family. By then you could lose a job. It's very disruptive, and there's very little evidence that it helps people in the long run.
I understand that. Thank you for sharing that.
So I have a question. It's like everybody said, well, before the Baker Act, it was so much worse. Well, what was it? What was that condition before? What was so bad? But because those who still seem to support it say that yes, it does do good. But could somebody explain to me where is the good, and what was so bad before that this apparently fixed, that some people think fixed?
I believe I mentioned that it was way worse before. I'm going to clarify that. Before the Baker Act, there was no specification on how long somebody can be held in a psychiatric institution. So
Thinking of that, I remember back to being a child and I grew up in New England and going towards the city, and I would always ask what this one looked like a hospital. But I can remember being told it was a mental facility. So I wonder if that's where they went and then they just got left there.
Oh, could be.
I don't think they have those anymore, do they? Does anybody know? Like an actual, back in the days, I'm talking 60s and 70s.
Like,
do
they still have those?
In New York, they do anyway.
In New York, okay.
It's pretty large state.
But the point that I at least wanted to make, Francis, was the fact that there was no specification in the law, as in you can be released in 3 days, or it was simply you're in there and you're at the mercy of the decision of the doctor or the orderly or the staff in there. So that aspect is what I refer to as being worse. Were the conditions of mental health patients in psychiatric hospital worse in 1970 compared to today? I believe so. Again, there's many different aspects and details we can talk about to clarify that point, but at least on that comment, that's what I refer to, Francis, if that answer.
Thank you.
Okay, fair enough. Okay, so now we are going to the next part. Okay, so I'm not going to go into this. We're not going to have the time. One datum that I found there that I wanted to share in case you guys didn't know about this. In the US alone, nearly 80 million people are taking psychiatric medication, drugs, including 8.5 million children, with more than 1 million between the age of 0 to 5. Coming from IMS Health Vector 1 National Database. A recent article came out about 5 months ago, I would say at this point, from Dr. Moncrief from the University College of London on the subject of chemical imbalance, which is one of the main theory that's used in order to diagnose somebody with a mental disorder. And the study declares that it is not clearly scientific. This theory isn't based on specific tests. And so is it a legitimate way to diagnose somebody? That right there is a discussion of probably 2 hours. And I'm sure you guys have different, opinion about this, maybe experience about this, but I found it quite fascinating that this study came out 5 months ago. This is not the only study or the only declaration from mental health professionals on that topic. From CCHR, we were interested in that because that is one of the key things that we are in disagreement about. I'm not saying that everybody has to be in agreement here, but that's at least what we believe. You can always share something about this if you want. I wanted to at least bring it up. So before we go, so this is supposed to be a mental health rights forum. We now have about 5 minutes before the end. It's a try and error. Okay, this is the first time we're doing such a forum, and the purpose of it is we need to come out of this with actual practical things that could be done in order to improve mental health rights. Is there anybody in there in Zoom or in the office here that would like to summarize or kind of pinpoint the different discussion point that we had? What do you think is the most important? Exactly. Where do we go from here? Francis put in the chat. Well, I'm asking you.
I personally think if it's mental health, correct, that we start educating the public more, getting out and talking more about it, because if we don't, that's where it can lead to the Baker Act. So I think we just need to get out and advocate and de-escalate situations.
Okay, so
Do
education.
seminars, educate.
Okay, so it's a public awareness on a massive scale.
Correct.
Okay, fair enough. We have to do so much more than talk. It is serious. I agree with you, Francis. Okay, so from CCHR, one thing immediately I'm going to tell you is we have a legislative email system that we have in place during legislative session. In Florida on March, I think it's March 12th, March 6th. Yeah, the legislative session are going to start. And what we do is our volunteers are monitoring the different bills that are being proposed on the subject of mental health rights specifically. And we put together an email that we send to the people that are signed up for this and explain what we agree or disagree with. And we propose people to send their own comments or their own concern about that bill. If that's something that you guys want to be involved in, we have that going, and we sent out probably 90,000 emails in the last legislative session in 2022. That's one thing to answer the question that I asked on, like, where do we go from there? Great. Yes, ma'am. Claudia.
Is there a calendar of events? I agree with this beautiful lady in front of me.
Tammy?
Yes,
Okay.
thank you. That we need to educate more. I mean, I personally, I have no idea, and I'm involved only because my husband was in the Air Force. But if there was more education, volunteer members involved, and if we can have more on the Facebook or whatever media that you use, so that we know of any upcoming events, and then we can sign up and save the date in our calendar so that we can sign up
In advance like this?
Yeah, so that we can come in and help educate the community, or if you're holding events here or out in the community.
Okay.
Yeah.
That can be done.
Yeah.
From at least CCHR, what we do here locally or in the state, we can do that.
Yeah. If we can just go as big as.
Yeah.
whatever needed.
And let me ask this, Sheila and Asia, do you guys have any kind of community events in your, with the organization that you work with that could, I guess, assist in that direction of assisting on educating more people out there? Anything to share on that?
You asking me? Sorry.
Sure.
We do have education for the parents and the teachers and the local units. In regards to mental health, we put a lot of emphasis. So if you go to our website, National PTA, you will find that we are very focused on mental health because it's a big thing in the school system. And because it's a great initiative from us, we do provide resources for parents, students, teachers, and we have a lot in our website. So I invite anybody to go to National PTA or Florida PTA and get the information that we have. But we do support the schools in that endeavor.
Fair enough. Thank you for sharing that.
Sure. Able Child just did an event. We're kind of focusing a little bit on the media and trying to get MedWatch. MedWatch, we really support that. Any kind of legislation that people can report adverse events to any medication, but our focus is psychiatric drugs. So we have our website is kind of filled with information, and then you know, it's great to have the PTA here because, you know, the PTA can really be a vital part for, you know, getting information into the schools from CCHR. I mean, that's something that parents should be able to get access to, Able Child and CCHR, because the schools, it's often been my experience that that's been a block to get parent groups that are, you know, pro informed consent regarding this. So the PTA being on this call, I think, is huge. And as far as upcoming events go, we're just focused on the legislative process. So we would be very interested in some of the stats that you put out. Like you said, the report where it says how many kids are on between what ages. I would be very interested in that, and I would be happy to publish that on Able Child.
Fantastic. Thank you for sharing that. Good. All right. Well, events, public awareness. I see that legislative action seems to be something, right? If you guys have contact with legislators as well in your own state or in your own, that represent your own county or your own area, if you're involved in like meetings with them or, you know, what I found out, oh, one thing I'm going to bring up is legislators are at their local office all year long. And apart from the legislative session that starts, they go up to the Capitol and they just, you know, do this 2-month full-time thing. One thing would be to visit them and voice your concern, bring them materials, bring them stats. I don't know if that's something you guys are doing already or interested in, but it's an idea.
Yeah, I wonder if there is a mental health group that goes up. I know there is on the Hill, it's in March for veterans for oral health.
For oral health.
Yeah, they go up and they talk to all the, so I wonder if there is a group that goes up. That'd be good information to have.
About mental health.
Yeah, there's a
Rights
group
or
that goes.
okay. Fair enough.
Can you tell me, when is the legislative session in Florida?
It's starting at beginning of March and it's about 2 months usually. It can't.
That's it for the whole year, 2 months?
That's correct. And every year it happens. And it's a matter of moving, you know, the way we've been successful in, to some degree, you know, educating legislators or doing something effective in that area is by getting a large number of people to communicate their concern to their own representatives.
So if someone lives here only part-time, you know, seasonal resident, like half a year here and half a year some other state, will they still be receptive to listening to you?
Yeah.
It's not your,
literally,
it's not your Florida residence, it's legally, even though you're here 6 months.
that is correct. I'm sorry, I don't think I fully understood the question. You're saying somebody that lives in Florida for 6 months?
Well, yeah, I'm thinking to myself,
Fair enough.
so I'm actually a resident of New York State, but I'm here 6 months, and this is where the issue happened that I saw with my own eyes. And I don't care where I make a difference, but I think I have to start at least here because I have stuff about here. And I don't know any comparable thing like this in New York, but maybe I just don't know because I didn't even know about the Baker Act before it happened.
Okay.
So I didn't know if I was at a disadvantage or if I should not be talking to these legislators because I am not a legal resident of the state, although I own property in the state.
Yeah. Do you own property in Florida?
Yes.
Can you ask?
Yes.
Yeah. Okay. I think, you know, even if you're from Nevada and you have a family member that was Baker acted in the state of Florida, voicing your concern to a representative, even though you're not a voter, they're gonna pay attention to some degree to that. You know, a legislator is gonna think with, obviously, are you in my area? Does that really matter for my area? Well, I'm a tourist and I showed up in your city or your state or your area, and this happened. If you document what occurred and communicate what occurred to them, if they ignore it, then you know who you're dealing with. But if they're not ignoring it, then you know what I'm saying? That's, I think.
So I'm wondering, like, when you have the federal House of Representatives. So is there anything that you could do at the federal level that may help impact the state level? I understand that there are a lot of state differences between the states and the federal government, and Florida likes to be more independent if possible. But I'm just wondering if maybe there's something we should be doing at the federal level as well, or if this does not really apply to them at all, because this is the only state that does anything like Baker Act. Is that correct? I don't know.
The Baker Act is the mental health law in Florida specifically. There are mental health laws in every single state that are similar or different, meaning involuntary psychiatric examination laws. I think, but doing both, educating legislators in both levels needs to be done, because a legislator that's up there in DC that represent the state of Florida as a senator in Congress, if he's not aware of the problems there is in the mental health field, then how is he going to even make decision federally about mental health? Like awareness, like knowledge is power, people say, so that's my take on it, at least. I don't know if other people has different ideas, but Sheila, Asia, I don't know if you guys are dealing at all with federal level things or not, but if you have anything else to share on that.
Or I was thinking maybe if there was something that happened in another state that might help provide more evidence for this state to say something or promote something.
Absolutely. I believe that influences other states. The state of Florida is a kind of a state that other states listen to. So whenever there's legislation that's done, that's sensible, that can inspire other legislators in others, like we have people contacting us on the subject of parental rights and involuntary psychiatric examination of minors from other states. And we're telling them what we do here. And we give them the data, we give them the stats for the state of Florida, and they can use that in their own state. We've had examples of that. I don't have them on top of my head here, but
Well,
go ahead.
If I could just say that one thing Able Child has noticed about CCHR is that they have chapters and offices really around the world. And the one in New York is very on the ball. And I feel like wherever you are, you definitely can make a difference, and pass information and stats out. So I just know that CCHR is pretty active in around the world and around the United States. So, I do agree that Florida is right in a good position for us to take on this new legislative session, and everybody can work together that is on this call. I'm happy to do that. Like if anybody wants to reach out to me, I usually respond, on ablechild.org, and I'm happy to work with anybody to to help, because our children's lives are at stake.
Thank you, Sheila, for sharing that. Okay, good. So how about I shoot an email to all of you guys with some of the key points that we went over, ideas. I do wish that this forum expand in the idea that, I think a forum can be a good way to communicate those different things that you guys are all going through. And if there is anything that you want to answer me by email on what kind of topic or what kind of mental health rights issues you would like to take up during a forum like this, maybe there are ways that we can actually educate legislators on this and invite them to one of those forums. And you, Sheila, or you, Anita, you will show some stats or something. You know what I'm saying? Like, it's a platform that could be used. So if you guys are inspired with this, well, that's great. And if you're not, then there you go. It is what it is. So I would like to thank you all for attending this hour and 5 minute long Zoom meeting and meeting in person. Again, thank you very much. And I hope I can see you to the next one next month.
So when is the next one? I didn't know. Is this something that's going to be happening every month?
Yeah, that's going to be happening every month. And the next one is going to be Wednesday, 1st of March, 2023, 5:30 until 6:30. So we're going to try to stick to the schedule here. Sorry about that.
So
And
you're
it's going
gonna
to
try
be,
to do it the first Wednesday of every month? Is that the thing, or the first day of every month?
it's going to be the first Wednesday of every month.
Okay.
Yes, ma'am. There you go. Thank you very much, everybody.
Thank you.
Thank you.
Thank you.
Okay, cool. See you next time.
See you. Thank you.
Thank you, Asia.
Bye.
Okay,
Thank
bye.
you so much, CCHR, for all your work.
Woo! Thank you,
Thank
Sheila.
you. Yeah,
Okay, and
Cecilia,
I
for your
put-
work. Thank you.
I put my email in the chat.
Not a problem. I will send you the goods.
Thank you.
Okay, cool. Thank you for connecting. Appreciate it.